I just want to stress, as we know, that this advocacy for mental health is so important, and particularly to have you, President Carrizo, here is a very strong sign of political leadership that's required across. And I was thinking about you also because, of course, we're here in Canada, and we can't continue but mention that Justin Trudeau's mother announced that she had bipolar disorder a couple of years ago. She's written books, she speaks actively, and I think she's become one of the strongest mental health advocates. And I think since we're here in Canada, that's something that we must mention. When I was meeting with Rajesh, I noticed first of all that you were so kind, and he has these very, very kind eyes when you see him. And Raghu's right now is a third-year medical student here in North America. He's over in Massachusetts, where he almost entirely grew up in Boston, apart from a brief period over in India. His father's a scientist, his mother works in healthcare IT, so his brother's taken over on the IT side and he's taken over on the scientist side. Since about 13 years old, you've been tinkering around with your father's biotech company, you've been working in research laboratories through high school and now also in college. But what's been so different was the experience of going to India as a volunteer, because you said you wanted to engage in a grassroots experience there. And one emotional experience there changed everything and has brought the science to life. Raghu.
Close your eyes. Now raise your hand if you've ever felt depressed, anxious, or just had a bad day. Open your eyes and look around. You're not alone. Depression alone will become one of the world's leading causes of disability in less than 4 years. In India, where I work, it has the highest rate of suicide in the youth population at 35 for every 100,000 people. And yet, mental disorders are some of the world's most prominent and treatable causes of suicide. My journey into mental health began in 2010 when I was volunteering in India with a health NGO. And my cousin, who was in India, began to have seizures. Much of my family has been fortunate to have a decent education. But what really struck me was how many of my family members didn't go to a doctor to help my cousin. They went to faith healers and traditional practices. Unfortunately, I soon realized that my cousin's story was not unique. Now put yourself in the shoes of a farmer from an Indian village with a child that suffers from schizophrenia. What's your role as a parent? It's to protect your child from doing harm to themselves or to anyone around them. Unfortunately, what happens then is that the child gets hidden away and forced into a cycle of poverty, discrimination, and isolation. This stigma, I believe, primarily stems from a lack of knowledge and education about mental health. And so this is what really motivated me to start the Minds Foundation, which is an NGO dedicated to eliminating the stigma surrounding mental illness. Growing up, I was told one thing about my family, and that was education is power. Minds is dedicated to assessing the knowledge and attitudes towards mental illness in school teachers, children, faith healers, sex workers, and everyone in the communities in which we work. And using all of that data, we create targeted education programs so people can really understand what mental health is. To date, we've educated over 30,000 rural citizens in the state of Gujarat, India. We've educated and trained over 200 female workers to become community mental health workers to assist in our work, rehabilitation of patients, educate and recognize symptoms for those in need in their communities. Through partnerships with local clinics and physicians, we've been able to provide direct medical treatment for 650 patients from 87 villages. And this coming year, I'm excited to announce we'll be expanding to another 170 communities. However, through our work, we've realized the rise in youth suicide in these communities. And this rise can be attributed to a number of factors, including economic, social, and emotional resources. Some even attribute it to a rise in urbanization and the breakdown of the traditional large family support system. As young Indians become more progressive, their traditionalist households become less supportive of their choices pertaining to financial independence, premarital sex, marriage age, and taking care of the elderly. So what are we as youth doing to change this? Well, at Minds, we partnered with local primary schools to educate school children at an early age in mental health. We've implemented programs to train school teachers in detecting symptoms and becoming frontline counselors for their students. Because I believe that doing so, we will provide the proper avenue for the maintenance of dignity and the development of help-seeking behaviors. Sadly, the rise in youth suicide is not only in India, it's increasing worldwide, with about one suicide occurring every 40 seconds across the globe. This rise in youth suicide is shameful, and we're the ones who are responsible for it. So together, we must all stand up, speak up, and advocate for better policies and implementation of resources for mental health. And so I welcome all of you to please take the programs which we've developed at Minds back to your home countries, because my dream is to build a world in which anyone can ask for help without shame or embarrassment. And over the past 3 days, I've learned that all of you here at One Young World can make this dream into a reality. Now, many of us raised our hands at the beginning of this talk. We're the youth that can change the world, but we can't do it if we don't take care of each other. So promise me, before you leave Ottawa, that you'll connect with at least one person here and check with them beyond the Facebook posts and the messaging and beyond your iPhones to simply ask, how are you doing today? And by doing so, we can together prevent the rise in youth suicide. Thank you.
Stunning, stunning, stunning.